The CASIO camera's unique tools enhance the dermoscopic features seen with basal cell carcinomas. So let's look at some case examples. Our first case is this pink lesion, and it's really non-diagnostic clinically. Dermoscopically, however, it's characterized by these blotches and strands as well as some erosions, and this is characteristic of a superficial basal cell carcinoma. In this particular case, clinically, very difficult. Dermoscopically, there's some suggestions of some fine vessels, and there are areas of pink and white. However, in the near ultraviolet light mode, we see these thick serpentine vessels, which clinches our diagnosis of a superficial basal cell carcinoma. In this case, again, clinically and in the typical polarized or non-polarized mode, very, very difficult. Some suggestions of some fine vessels. In the near ultraviolet light mode, here we can see these beautiful serpentine branch vessels, another superficial basal cell carcinoma. Different pattern with this pink lesion with some brown speckling. Dermoscopically, an easy diagnosis with these beautiful leaf-like structures. Different pattern. Clinically, this lesion could be either an intradermal nevus or perhaps a basal cell. Dermoscopically, we see these non-aggregated brown globules. This is very characteristic of a pigmented nodular basal cell carcinoma, and the pathology was taken with the CASIO camera. In this dome-shaped raised lesion with dark areas of red, an area of ulceration, dermoscopically we have ovoid nests, we have blotches and strands, we have an area of erosion and some serpentine vessels. This is a pigmented nodular basal cell carcinoma. Now in this lesion clinically, very difficult to see. However, in the ultraviolet light mode, we see these beautiful serpentine branch vessels. We also see a couple of serpentine branch vessels in the contact polarized mode. The histology as well was taken with this infiltrative basal cell carcinoma. In this case, clinically a whitish papule. Dermoscopically, we have one serpentine branch vessel with these milky white areas. In the ultraviolet light mode, we see these thick serpentine branch vessels. These are actually enhanced with the vascular enhancer. It's a beautiful case demonstrating this basal cell carcinoma. In this case, very, very subtle both clinically and dermoscopically, as well as in a near ultraviolet light mode. But when we use the vascular enhancer, we can now make our diagnosis of a basal cell carcinoma. In this lesion, we actually have an area clinically that's pink and raised and some brown at the periphery. With dermoscopy in the contact polarized mode, we see some serpentine branch vessels, and at the periphery some fine lines slightly curved. In the near ultraviolet light mode, we see milia-like cysts with the serpentine branch vessels, a collision of a basal cell and early seborrheic keratosis. In one final case of another collision of a basal cell and seborrheic keratosis, you see the serpentine branch vessels, and in the corner you see the bulbous projections.